Venipuncture involves puncturing a vein for the removal of a venous blood specimen. Venipuncture is performed when a large blood specimen is needed for laboratory testing. The medical assistant is often responsible for performing venipuncture in the medical office. The vacuum tube method is the fastest, most convenient, and most economical venipuncture method. The medical assistant will show you how to collect venous blood using this method. The specimens will be transported to an outside laboratory for testing. Before proceeding, sanitize your hands. Greet the patient and introduce yourself. Identify the patient by asking the patient to state his or her full name and date of birth. Compare this information with the data in the patient's chart. It is important to make sure you have the right patient to avoid collecting a specimen on the wrong patient by mistake. If the patient was required to prepare for the test, check to make sure she has prepared properly. If the patient has not followed the patient preparation requirements, notify the physician for instructions on handling the situation. The physician will usually want you to go over the preparation instructions again and reschedule the venipuncture. Assemble your equipment. To perform this procedure, you need a 1 or 1 1/2 inch double-pointed needle with a gauge between 20 and 22. You also need a plastic holder, tourniquet, antiseptic wipe, sterile gauze, an adhesive bandage, and a laboratory request form. Select the proper evacuated tubes for the tests ordered by the physician. The physician has ordered a CBC, a comprehensive chemistry profile, and a thyroid profile. The lab directory indicates that you need a lavender tube and 2 serum separator tubes. Check the expiration date of the tubes. Outdated tubes may no longer contain a vacuum and as a result could not draw blood into the tube. Label each tube with the patient's name, the date, and your initials. Since the specimens are being tested at an outside laboratory, complete a laboratory request form. Next, you must prepare the vacuum tube system. Remove the cap from the posterior needle using a twisting and pulling motion. Insert the posterior needle into the small opening on the plastic holder. Screw the plastic holder onto the lure adapter and tighten it securely. Pick up the first serum separator tube and place it loosely in the plastic holder. Open the sterile gauze pack and lie it flat to allow the gauze pad to rest on the inside of its wrapper. Position the evacuated tubes in the correct order of draw. The serum separator tubes must be drawn first, followed by the lavender tube. Explain the procedure to the patient and offer reassurance to reduce fear or apprehension. Tell the patient that a small amount of pain is associated with a venipuncture, but it is brief. Never tell the patient that the venipuncture will not hurt. Perform a preliminary assessment of both arms to determine the best vein to use. Ask the patient which arm has been used in the past to obtain blood. Apply the tourniquet 3 to 4 inches above the bend in the elbow. Make sure the tourniquet lies flat against the patient's skin and does not pinch the skin. It should be snug but not tight. Ask the patient to clench her fist. The combined effect of the tourniquet and the clenched fist causes the antecubital veins to stand out. This makes the veins easier to palpate. With the tourniquet in place, thoroughly assess the veins of first one arm and then the other to determine the best vein to use. Position the patient's arm to allow for easy access to the antecubital veins. Extend the arm in a straight line from the shoulder to the wrist with the antecubital veins facing you. Support the arm on an armrest, a rolled towel, or by having the patient place the fist of the other hand under the elbow. Thoroughly and gently palpate the selected vein with the fingertips to determine the direction of the vein and to estimate its size and depth. Press lightly and then release the pressure. The vein should feel round, firm, elastic, and engorged. Trace the path of the vein several times by rolling your index finger over the vein. Never leave the tourniquet on for more than 1 minute at a time, as this is uncomfortable and may alter test results. Wait at least 2 minutes before reapplying the tourniquet. Remove the tourniquet. Cleanse the puncture site with an antiseptic wipe, moving in a circular motion, starting from the inside and moving away from the puncture site. Allow the site to air dry. This gives the alcohol enough time to destroy microorganisms on the skin and prevents the patient from experiencing a stinging sensation when the puncture is made. Drying also prevents wet alcohol from entering the blood specimen. This results in hemolysis of the blood specimen, leading to inaccurate test results. Do not touch the area, wipe the area with a gauze, or fan the area with your hand. This causes contamination of the puncture site, and the cleansing process must be repeated. Place your supplies within comfortable reach of your non-dominant hand. This prevents you from having to reach over the patient to pick up items after you have punctured the patient's vein. Doing this moves the needle, which results in pain and possible injury to the patient. Reapply the tourniquet and put on your gloves while the site is drying. Pick up the vacuum tube setup and rotate the shield backwards toward the holder. Remove the cap from the needle using a twisting and pulling motion. Hold the vacuum tube system by placing the thumb of your dominant hand on top of the plastic holder and the pads of your first 3 fingers underneath the holder and evacuated tube. Position the needle with the bevel facing up. This allows for easier insertion into the skin and vein, resulting in less pain for the patient. Position the evacuated tube so that the label is facing down to allow you to observe the blood as it fills the tube. To anchor the vein, grasp the patient's arm with your non-dominant hand and place your thumb to the side of the puncture site. This position keeps your thumb out of the way of the vacuum tube setup so you can maintain a 15-degree angle when entering the vein. Use your thumb to draw the skin taut over the vein. This makes it easier to penetrate the patient's skin. Position the needle at a 15-degree angle to the patient's arm while resting the backs of your fingers on the patient's forearm. A lower angle may cause the needle to enter above the vein. A higher angle could cause the needle to go through the vein and cause bleeding and the formation of a hematoma. Ensure that the needle points in the same direction as the vein to be entered. Position the needle so that it enters the vein approximately 1/8 inch below the place where the vein is to be entered. Tell the patient that she will feel a small stick. Using one continuous steady motion, enter the skin and then the vein. Using a continuous motion helps reduce tissue damage. You will feel a sensation of resistance followed by a release as the vein is entered. When the release is felt, you have entered the vein and should not advance the needle any further. Stabilize the vacuum tube setup by firmly grasping the holder between your thumb and underlying fingers to prevent the needle from moving. Do not change hands during the procedure, as this may cause the needle to move. Anytime the needle moves, it is painful for the patient. With your non-dominant hand, place your first 2 fingers on the underside of the flange on the plastic holder. Place your thumb on the end of the tube. Using the flange prevents the needle from moving forward when you push the tube forward. If the needle moves forward, it could go completely through the vein. Slowly push your thumb to move the tube forward to the end of the holder. This allows the posterior needle to puncture the rubber stopper. Blood will begin flowing into the tube if the needle is in the vein. The suction of the evacuated tube automatically draws the blood into the tube. Allow the tube to fill until there is no more vacuum, indicated by the cessation of blood flow into the tube. Do not remove the tube before the vacuum is exhausted. If you do, a rush of air enters the tube and damages the red blood cells, leading to inaccurate test results. Also, a tube containing an additive must be filled completely to ensure the correct ratio between the additive and the blood specimen. An incorrect ratio can lead to inaccurate test results. Remove the tube from the holder by grasping the tube with your fingers and placing your thumb or index finger against the flange. Using the flange keeps the needle from pulling out of the vein when you pull back on the tube. Pull the tube off of the posterior needle and place it on your tray. Using the flange, carefully insert the second serum separator tube into the plastic holder and push it forward to the end of the holder. Allow the tube to fill to the exhaustion of the vacuum. Pull the tube off the posterior needle and place it on your tray. Using the flange, carefully insert the last tube into the plastic holder and push it forward to the end of the holder. Remove the tension from the tourniquet by pulling upward on one of the flaps of the tourniquet. Ask the patient to unclench her fist. The tension must be removed before the needle. Otherwise, the pressure on the vein from the tourniquet and the fist could cause internal and external bleeding around the puncture site. Remove the last tube from the holder. Removing the last tube prevents blood from dripping out of the tip of the needle after it is removed from the patient's arm. Lavender tubes contain an anticoagulant. Gently invert the lavender tube back and forth 8 to 10 times before laying it down. A tube containing an anticoagulant must be inverted immediately after drawing it to prevent the blood specimen from clotting. Careful mixing of the blood with the anticoagulant prevents hemolysis. Place a sterile gauze pad slightly above the puncture site. The gauze stabilizes the skin as the needle is removed. This prevents tissue movement and patient discomfort as the needle is removed. Carefully withdraw the needle at the same angle as that for penetration. Using the same angle reduces tissue damage. Immediately move the gauze over the puncture site and apply firm pressure to stop bleeding. Do not apply pressure to the puncture site until the needle is completely removed. Push the safety shield forward with your thumb until you hear a click, which indicates the shield has locked into place. Do not push the shield forward by pressing it against a hard surface. Immediately discard the plastic holder and the attached needle in a biohazard sharps container. The OSHA standard requires immediate disposal of the needle and holder unit to prevent a needle stick injury. OSHA does not permit the removal of the needle from the holder. The holder is often contaminated with blood and must not be reused. To make sure you understand this procedure, the venipuncture will be performed again without pausing, starting with penetration of the patient's vein. You must continue to apply pressure with the gauze pad to reduce the leakage of blood from the puncture site externally or internally. Cooperative patients can be asked to assist by applying pressure with the gauze pad for 1 to 2 minutes. The arm can be elevated to facilitate clot formation. Do not allow the patient to bend the arm at the elbow because this increases blood loss from the puncture site. Stay with the patient until the bleeding has stopped. Apply an adhesive bandage to the puncture site. As an alternative, the gauze pad can be folded into quarters and taped on the puncture site to be used as a pressure bandage. Instruct the patient not to pick up anything heavy with that arm for about an hour. This causes pressure on the puncture site, which could result in bleeding. Remove your gloves and sanitize your hands. Chart the procedure. Include the date and time, which arm and vein were used, and any unusual patient reactions. Transport the tubes to an office laboratory work area. Without touching the tube stoppers, place the serum separator tubes in a test tube rack. Allow them to stand in an upright position for 30 to 45 minutes for clot formation to occur. Apply gloves and process the serum separator tubes by centrifuging them for 10 to 15 minutes. Centrifuging the tubes causes the gel in the tubes to become fluid and form a barrier between the serum and clotted blood cells. Prepare the specimens for transport to an outside laboratory. Place the serum separator tubes and the lavender tube in a biohazard specimen bag. Remove your gloves and place the laboratory request in the outside pocket of the specimen bag. The laboratory must have the completed request form to know which laboratory tests have been ordered by the physician. File a copy of the lab request in the patient's chart. Sanitize your hands and chart the date the specimen was transported to the laboratory in the patient's record. Store the tubes as specified in the laboratory directory until they are picked up by the laboratory courier.